Hello, I'm Dr. Claire Guest, and I'm delighted to
Hello.
have this opportunity to speak to you all about the work of the charity Medical Detection Dogs, and also for those that perhaps heard my talk earlier last year, to update you on how the progress has been with our COVID-19 detector dogs, which is obviously a new and very exciting project. Now, Medical Detection Dogs has actually been going since 2008, and I was really lucky to be part of one of the first trials that were published in the British Medical Journal in 2004 that indicated that dogs could be trained to detect the odour of cancer. Now, some of you may remember this. It made big news at the time, and there were two levels of which it was exciting. One, that cancer, in fact, did have an odour, because that, of course, was unknown prior to that time, but also that a dog could be trained to recognise that odour. And at first, there was huge scepticism, despite a very robust publication. Many people felt that it was either sort of a joke, or even if they believed that it could be true, they couldn't really understand how this might be applied, how it might make a difference to diagnostics in the future. But I always believed that it could, and I say in 2008 the charity Medical Detection Dogs was formed, and since that time the work has progressed hugely. We now have a royal patron, and as you can see from these pictures, I'm very lucky to present in front of Her Majesty the Queen 2 years ago now. And this work has moved on so that it is now recognised and it is understood that there may be many ways in which the ability of the dog to smell human disease could in fact transform diagnosis in the future. Now, firstly, before I talk about our update, for those that perhaps don't know much about our work, I thought I'd just do a recap. So many of us live alongside dogs. We understand this wonderful relationship we can have with our canine partners, but what perhaps we didn't realise is, although the relationship between man and dog has been for many centuries, in fact, if you go into the ancient caves, pictures, drawings of men hunting with dogs, despite this long relationship, research into how dogs affect us or how we work with dogs is actually very recent. And some of the first work was done in the 1980s, and I was very lucky to be involved in this work. And that's when dogs were being taken in to visit individuals in nursing homes or in rehabilitation centres. And work was being done to see the effect, or the indirect effect, that the visits of these dogs may have on people within residents within these places. Now, first of all, a psychological effect was recognised. But then moving on from that, actually, it was then realised that dogs actually not only make us feel better, but they actually have a direct effect on our physiology. So reducing our blood pressure, our heart rate, and even reducing blood lipids, so those nasty fats that are in our bloods. Now, this was, quite incredible, and it led to a new sort of interest in research, which has led people to understand a lot more about how our relationship with dogs we can benefit from this relationship. But it's only, I say, really recently that we've looked at how dogs may actually assist in diagnostics. Now, why might a dog be able to do this? What is it about a dog that means it could help us in this way? Well, as many of you will know, dogs have this incredible sense of smell. They have, a dog here, Florent, could have up to 350 million sensory receptors in her olfactory epithelium. Now, us humans have 5 million, and we have a reasonable sense of smell. So imagine living in a world with 350 million. It also means that she can detect down to parts per trillion. Now, parts per trillion means nothing really to us, but just to give an example, if a human can smell a teaspoon of sugar in a cup of tea, which many humans can, a dog like Florent could smell a teaspoon of sugar diluted in the volume of water held in the size of 2 Olympic swimming pools. So that is a part per trillion, and it shows this incredible ability of dogs to detect very low odours. Now, in addition to this, they are actually designed, they are olfactory machines, they are biosensors with waggy tails, when they sniff something, when they're interested, their sniff rate becomes very rapid. And this produces a little vortex, and this little vortex means that the volatiles are actually sucked up into the nose more rapidly. Quite incredible. But why might this make a difference to health? Well, what we now know is, in addition to our own unique odour, that odour that we all have that is totally unique to us, and we know a dog can track our footsteps across the footsteps of many hundreds of people. What we now recognise is that when we have any disease or condition, our odour changes, and it is changed by the disease. And we now recognise that each disease has its own volatile fingerprint. Now, what do I mean by volatiles? VOCs, volatiles. We're all familiar with volatiles, though we may not know it. So you sit next to somebody who has a nice aftershave or perfume on. The volatiles coming off the skin, so going from the perfume or aftershave into the air. These are volatile molecules that go into our noses, up into our olfactory epithelium, and we smell a nice smell. We can also, of course, smell not so nice smells, but the volatile signature for disease is unique to the disease, and dogs can be trained to recognise them. So quite remarkable. So we have two sides to our work. We have our biodetection side, and our biodetection work would be where we train dogs to detect the odour of specific diseases by presenting samples to the dogs in a working environment, a training environment. So the first dog there is sniffing a sample, and she's actually trained, this dog is trained to find cancer volatiles. We also have our medical assistance dog program, and this is where dogs are trained to work one-on-one, to work alongside individuals who have acute episodes that result in hospital admission. Now, we normally talk about people who work with people who have a chronic disease, but that might have changes rapidly in their health that lead them to have to have hospital admission sometimes, on a daily, weekly basis. The dogs are trained to recognise an odour change in their owner, to warn them of an oncoming medical emergency, so that they can seek help before it becomes too severe. But if I focus first on our biodetection projects, well, here's a list of the projects that we have trained dogs to be able to recognise the disease odour successfully. Now, we always back up our work with research and peer-reviewed publication. Today, I'm not going to discuss in any detail these projects or the research that's gone into them, because I want to focus on the COVID update. But these are the diseases that we have successfully worked on and are able to show that dogs can detect reliably. Now, what I'd like to do is just show you a video of a dog working on some cancer samples. Now, when you train a dog by teaching it to become a discriminator, to become able to detect cancer volatiles or the disease volatiles from a background of any other disease or condition or any other thing that the individual may have eaten, or any other differences. So dogs sniff each sample in turn. If they smell the odour of the disease they're trying to find, which in this case is cancer, the dog will sit and stop. And if you watch this video, you'll see an example of how our dogs work.
So when Kiwi comes in, she's being trained to detect prostate cancer. So what that involves is her moving around the carousel, which is a round metal thing, and it's got 8 ports on it where the dog sniffs. Each one of them ports holds a urine sample of 1 ml. Now, these urines are coming from different people, healthy, unhealthy, some may have diseases, but are not the target odour that we're looking for. One of them will include that target odour, which is prostate cancer. When she searches and she comes across it, she'll pause at the position, then she'll consider what her actions are. She'll take a seat, sit down, look at the sample, and at which point, if it's correct, the handler will click, walk in and reward the dog.
Good girl. What a good girl. Get on in.
So I'm sure you all see now how the dogs work. And of course, when the dogs are in training, the handler would know whether the dog had given the correct answer. But of course, this moves on to a situation where we no longer know ourselves as handlers or trainers what the sample has come from somebody with an unknown status. And what we've done is we've looked to use this knowledge to develop and work alongside individuals who are providing diagnostics. Now, for cancer, we knew it would never be that a dog could be in, every doctor's waiting room, or that, hospitals would have rooms of dogs waiting for people to come in to be sniffed. We knew that what we're looking at is a translation of how the dog, with his incredible sense of smell, can translate what he knows into an electronic device. And we are working with the team at MIT in the USA, and hoping that this will become a reality much sooner than might be expected. Many people remember when we had no cameras on our phones, and then those first cameras on big brick phones where they took very rudimentary pictures. Now, of course, most people don't bother with a camera. They just use their phone all the time, unless you have a specialism in using and taking photographs. And that technology has moved very quickly, and this is exactly what the team at MIT believe they can do with the electronic nose. What we need to do, though, is we need to find a way of the electronic system knowing what this signature, what this volatile signature is. And the way that we'll do that is by using our dogs. And our dogs will translate, they'll be able to tell the machine, the artificial intelligence, in the best way they can, what the odour is. Now, if I said to you, well, say you didn't know what the smell of lavender was, and I had you for the afternoon, I thought, today I'm going to teach you what lavender smells like. What I'd do is I'd get you different flowers, some of which would be lavender and some wouldn't, and I would say to you, this is lavender every time we smelt it. As you became more discriminate, what I would do is I would be able to say to you, now this is a good example of lavender, and this is the poor example of lavender. And as we moved along the continuum, you'd start to get a very, very, very good idea of the odour of lavender. Now, what we need to do is we need to ask the only living creature on the planet currently that knows what cancer or bacteria smells like to translate this to by smelling a range of cancer samples, be able to tell artificial intelligence it's a good or bad example. Well, in fact, that in this case, the odour isn't there. And that's exactly what we're doing with MIT. And it's a very exciting part of our work. And it's where our work will lead, you could say, to the dog becoming redundant, the dog no longer doing the job, but handing over to an electronic device. But there are other diseases, and actually I changed the slide too quickly to bacteria, where the dog will be used for a long period. And at the moment, there's no way with the bacteria Pseudomonas. Now, this is a bacteria that affects people with immune compromised individuals and people with cystic fibrosis, other than doing a scope, a very invasive scope. And then culture, there's no way of knowing if people have Pseudomonas bacteria. And what we've done is some early studies with Imperial College, and we now know that Pseudomonas has an odour. Dogs can find it at very low levels very reliably. And we're now working towards a system where people will be able to send samples, which will be tested by the dogs within a number of hours, and then the results will be returned. So we know very quickly whether somebody has Pseudomonas. Very exciting. This is actually Florin, a prostate cancer detector dog. And what Florin's doing here, she flew out with me to MIT, and she's meeting quantum physicist Andreas Merschen, who is holding in his hand the prototype of his bioelectronic nose. And as I mentioned earlier, he's asking Florin what this smell of cancer is, or what the smell of disease is, so that he can program this nose so that the nose will then continue the work that Florin has started. So very exciting times. We enable dogs to give us as much information about samples as we can by using interfaces. And this is an example of an interface. This is a pressure pad. And this dog has been trained that if something is the best example of cancer, he presses the plate very hard. For example of cancer, or not cancer at all, then he wouldn't press the plate at all. And this video shows you a dog working this system. Now, this is actually Parkinson's disease, and in stand 3, there's a sample from somebody who has the disease. Stand 1 and 2 are from people who are elderly but are Parkinson's free. You quite clearly see the dogs talking back smell the odour of Parkinson. This is read by the machine and produces printouts, and 1 and 2, the white and the red, are the negative samples, and the green is actually the Parkinson sample. You can see very clearly that the printouts for 1, 2 and 3 differ. These are all people now who are Parkinson's clear. There are no samples from individuals with Parkinson's in this setup, and you'll see in this case you can clearly see that these are all non-Parkinson's patients, and it's very easy to read. So this is the way that we're working with science in order to move forward in diagnostics. Parkinson's is a disease that currently there is no early test at all for Parkinson's. The diagnosis is done, sadly, through physical symptoms due to damage in the vital areas of the brain. So, to do an update on COVID-19, I know many people will be interested in the work that we've achieved with COVID-19, because it's been in the press. There's been a huge amount talked about whether or not dogs could assist in detection of COVID-19, and whether in fact an individual with COVID-19 has got a unique odour that is different. So what we've established through a very robust period of research with our collaborators at the London School of Hygiene and Tropical Medicine and Durham University is that COVID-19 infection does have a distinct odour, that dogs can detect it with incredible speed. And the dogs that we used had a sensitivity from 82 to up to 93%. And very importantly, dogs could detect asymptomatic cases. So they could detect people who had no symptoms or people who had very mild symptoms. We didn't do any of the study on individuals who became very unwell or were hospitalised. So the dogs screening plus a PCR test could prevent onward transmission. And we have a wonderful team of dogs that were involved in the first study, and here they are. And actually 2 of the dogs, Tala and Asha, actually live with me. Now, one thing I'm sure that many of the dog owners will be very pleased to hear is that the charity has a complete no kennel policy. All our dogs live either with trainers or in volunteer homes. They come into work in the morning, we call it the school run, and then they go home again at about 4 o'clock, back to be doggies in their home environments. And this is the way that we find that our dogs work the best way, and welfare is of paramount importance to the charity. So this team of dogs were the dogs that proved the concept that COVID-19 does have an odour, that somebody, even if they're asymptomatic or in the early stages of the disease, has this odour and can be reliably detected. And this is a little piece here where I explain again how this works and what it looks like actually in the training centre.
At Medical Detection Dogs, we've trained dogs to detect human disease using their incredible sense of smell for many years. This is the first time we've ever trained these dogs to detect a virus. It is quite amazing how accurately they can detect the odour of COVID-19 from a small piece of sock worn several months ago. The dogs could do it at over 90% reliability. They were also very accurate at identifying when somebody didn't have the disease, and this is incredibly important. It means that they really understand the odour of COVID-19. We have now published our robust results, and the outcome of this work will mean that the dogs could be used for rapid, non-invasive diagnosis of people who have the virus, even when they have no symptoms or before they know they're unwell. This can make a huge difference as we start to come out of lockdown and people start to travel, and will hopefully assist in getting us all back to a more normal life as soon as possible.
So you saw the dog working there, and this is a second dog. Just again to show you, this is an asymptomatic individual that's in this position, and you'll see very clearly that the dog has no difficulty at all identifying the a small piece of sock that was worn by somebody who had the virus but was not showing symptoms. So an incredible ability of the dog, showing us that there are other ways that this could be diagnosed. Now, these are the results of the 6 dogs. And Tala, in fact, showed a very, very high sensitivity and specificity, which was as high as the PCR, the gold standard test. Now, why would dogs be helpful? Well, of course, these gold standard PCRs, as anybody will know that's had one, they take time. They take time to do. They have to be done well by the individual or by a healthcare professional. And they then take time for the results to come back. And in fact, many people that go into to have an NHS PCR may take up to 24 hours to get a result. Now, of course, this means that if you're needing to know an answer quickly and keeping people safe, that it becomes impossible to do when large numbers of people are moving. And with this level of accuracy, the dogs could offer something rapid and non-invasive that will work very, very well with confirmatory PCR if there's an indication. Now, many of you may have used lateral flow tests. Now, lateral flow tests are often used by the individual, and they give an immediate 5-10 minute result. Lateral flow tests are reasonable at finding COVID-19 infected individuals when they have what's called a high viral load. So when that individual is probably at the highest point of the disease, the lateral flow will relatively reliably pick it up. But what it won't do is pick it up in the early stages. It has very poor reliability at that point. Now, what the dogs could do is indicate quickly those people that are infected and are already passing on the virus before the LFT would actually identify it. So the collaborators at London School of Hygiene and Tropical Medicine have worked very hard on mathematical modelling, and what this has done is it has shown the impact of using dogs as a rapid screen alongside PCR tests. And they've shown that there is indeed, because of the ability of the dog to detect these low viral loads and to do it very, very quickly, there is a major impact that could be had, particularly in situations where large numbers of people are moving or are being in transport. Now, this model was actually done on an aircraft, and it was modelled on an aircraft coming from a country where perhaps there is a higher level of COVID-19, or where there may even be a new variant. And it clearly shows that using the dogs to screen individuals greatly reduces the number of people that need to be held to have a PCR that would in fact be negative. And the dogs are able to do this 300 people screen during the time that the passengers will be waiting to go come off the aircraft and go through customs. So there'll be no delay caused by the dogs at all. Of course, this is very, very interesting. What I'd like to do at this point actually is something that's very, very exciting, and that is to introduce Storm. Storm is the Viking sponsored medical detection dog, and we are incredibly grateful to Viking and the wonderful relationship that we have, and their generosity in sponsoring Storm to become an active COVID-19 detector dog. And this is Storm actually learning on the samples. So this is when Storm was learning on the sock samples. But some of you may have spotted Storm actually in the earlier video. Storm was actually now moved on, and he is now able to detect the odour of COVID-19 on individuals. Now, this is an example of how it might work in an airport environment or in an event. People are queuing to come into the event, and the dog Storm requires just a quick sniff to identify the person in this line who is actually wearing a shirt from somebody who had COVID-19 several weeks ago. So you can very clearly see there the dog's ability, and I'll just play it again for you, the dog's ability, a quick sniff per person, and then as soon as he smells the odour of the disease, he follows the individual and is rewarded by the handler. So we're delighted that Storm and some of his other doggy colleagues are now at the stage where deployment is starting. Now, the stage we're at is still very much an experimental phase. We're still working very closely with London School of Hygiene and Tropical Medicine, and we are consenting any individual that is sniffed by the dog through ethics, and then anybody that is indicated as positive would be asked to have a test, including a randomised generated number of individuals who the dog deems to be COVID negative. Now, we need to collect data from thousands of people in order to validate this, but I'm very proud and excited to say we are well on our way, and the work has been done through ethics, but much of it was done in visiting the homes of people who were COVID positive and putting them in a line of other individuals, of course, within ethics and extreme socially distanced guidelines. But you'll be able to see here that this is one of the first opportunities this dog has had to smell an individual who really has got COVID, is not just wearing a shirt from somebody who had COVID 7 months ago. And the second video again shows you this rapid screen, this ability, and this is Storm, who's an absolute star, Viking Storm, absolute star, indicating immediately an individual who is actually PCR positive. I'm sure you can see the wonderful applications for this. Dogs, Storm can screen 200 to 300 people an hour, very, very reliably. So what is next? Well, we are looking to deploy dogs at test centres where we can continue to collect data. We also have a couple of very big opportunities where we may be deploying the dogs and maybe screening a number of thousand people over a week or so. That will enable us to collect all the data required for our deployment model in the future. We're looking at venues where dogs can have the highest impact. So where is it that this rapid screen would make a real difference to human health? What sort of situation? What sort of intelligent? Obviously, it's not possible for every venue to have COVID dogs at the door, but there will be particular situations where there is perhaps considered to be a high risk, or whether there might be concerns of a new variant where dogs could be used very effectively. And we are working not only in the UK, but working as consultants and supporting many programs around the world in order that the knowledge we have can be disseminated so that we can assist individuals in other countries to be able to have effective COVID-19 detector dogs that are trained in the same way that ours are. So our paper has gone to preprint and is in publication, and very, very exciting times. The model of using dogs to screen people in this way, of course, is not new. Many of you may have been screened by dogs at airports for drugs, explosives, or agricultural produce. The dog will find a piece of fruit that you had in your bag and that you've forgotten. The actual model is tried and tested. Dogs love doing it. They are very much selected for this work. We use many rescue dogs that absolutely love to use their nose, and it really is a win-win situation. 2 of the dogs in that first trial were actually rescue dogs. One was from Battersea, and the other was a dog that actually had 7 homes before he came to us. So just before I finish, I'd just like to return to the fact that we do much of our work is still focused on our client partnerships, that we have an increasing number of clients. Historically, many of our clients actually were type 1 diabetics who had difficulties with their blood glucose levels and were suffering from diabetic comas or seizures. But increasingly, actually, we train increasing number of dogs for a condition that you'll see here, which is called POTS, postural orthostatic tachycardia syndrome, very common in young people and causes immediate blackouts with no warning at all. And we've discovered that dogs can indeed give a 5 to 10 minute warning, which is quite incredible. And just to finish, I'd just like to show you a video of we talked about the bigger picture. I've talked about, dogs perhaps training electronic devices so that in the future, cancer volatiles may be detected by a phone. I've talked about dogs screening large numbers of people. But I'd just like to also show you a little bit about our partnerships and the difference that they just make to just an individual.
Stephen was diagnosed with type 1 diabetes, which is autoimmune, when he was 3. Obviously, we were taken straight into hospital. He was put on insulin, and that in itself causes rises and falls in his blood glucose. As it's really, really tricky in a child to get exactly the right dose. They're constantly growing, catching viruses, temperature changes, everything has an effect on how much we need, which is where Molly, our assistance dog, comes in, because she can alert to those changes and warn us before he's dangerously low or too high for too long. And although we check using a blood testing meter 10, maybe more times a day, you're not monitoring every moment, but Molly is monitoring every moment that they're together. And so that gives us peace of mind and much better control. If we're at home, Molly fetches Stephen's blood glucose testing meter and she will find it from wherever we have put it. She can distinguish it from any other black case that's lying around. She jumps over, she fusses at Stephen, and she often comes backwards and forwards between the two of us. She knows she needs my attention as well. If we're out, she jumps up at his bag or my bag, depending on which one of us are carrying it, paws at it, she pulls at a toggle on his belt. And she's been teaching herself to undo zips. When we get in from school, she undoes the zip on his rucksack and fishes it out. Having Molly in our lives has made us all much more relaxed as a family. We're not dealing with severe hypos where Stephen is falling or trying to fight us with treatment. We're getting more rest, and Stephen's much calmer and much more relaxed. He was staying awake at night, worrying. So a very big thank you to Medical Detection Dogs for all their hard work and ongoing support.
Thank you all for listening, and I will of course be updating you on the progress of Storm and his remarkable doggy colleagues who are now leading the world in the screening of individuals with COVID-19. And I hope I will be privileged enough to come back and speak to you about the next stage in their progress. Just to finish, I'd like to say that I myself have experienced the incredible effect of dogs' ability to detect disease. I had a working dog who lived with me, Daisy, who I had from a very small puppy. She became a remarkable cancer detection dog, and she was the dog that taught me that actually a dog could indeed be trained to detect prostate cancer. Training, she started to behave differently around me, and I was 45 at the time. She started to look anxiously at me and started to nudge. And to cut a long story short, I was diagnosed with a very deep-seated breast cancer. My consultant, who is now a trustee, having become a huge believer in our work, said that had Daisy not drawn my attention to it, my prognosis would have been very poor, as it was extremely deep-seated. So 10 years later, I'm here after treatment and hormone treatment, radiotherapy and surgery. Sadly, Daisy has passed away now, and there's not a day that I don't miss her. But this book, Daisy's Gift, is a story of our life together and how the charity Medical Detection Dogs was formed. I was very privileged to be on Viking Venus recently, and there was a book in the library there, and I'm in the process of ensuring that every one of the wonderful Viking ships has a copy of Daisy's Gift. So if anybody's interested in reading it while they're on board in that beautiful environment, then I hope you enjoy it. And just to finish, again, to thank you, to thank Viking for their support, to thank Viking for the support that they're giving to Storm COVID-19 Detect Dog, and to say that for those that perhaps aren't interested or don't have a close relationship with dogs, that dogs are incredible biosensors, and the relationship that man has with dogs over the centuries has, I think, enriched the lives of many. And I hope that everybody has found this interesting to listen to. Thank you very much.